Okay, today we're going to talk about VBAC. What is it and is it possible? VBAC stands for vaginal birth after a cesarean. Why is this important? It is important because a cesarean is a major abdominal surgery, and there are obviously a lot of complications that can come with that. Some of the complications include not being able to breastfeed or bond well with the baby, and a lot of people are left with pain long after their surgeries. So Healthy People Initiative of 2020 recommends that 18% of people that have had a C-section have a VBAC in the future when they have future babies. We are not currently at that rate. We are at 16%, so the United States has some work to do. We are currently 32% of people are giving birth through C-section, which is also, it's recommended to be much lower than that. VBAC is important and desired by a lot of people because they want to avoid another major surgery. So the important thing is to find providers that are supportive of having a VBAC, and the provider can help you with determining looking at your health record and determining how many surgeries you've had in the past, how it healed, what kind of surgery you had, because there's different, like the transverse cut versus a longitudinal cut. The transverse cut is more common, and it is much more safe to have a VBAC because the main thing that providers worry about is uterine rupture during labor, which is still a very small risk. It's only 0.3% to 1%, depending on the source you look at. So it's a small risk, but it can be a very catastrophic risk because it can lead to hemorrhage for the mother or baby. And if the baby is still attached to the placenta and not born yet, that means the oxygen of the baby is cut off. So it's important to find a provider that is very familiar with helping with VBACs and knows the risks and can help you look at your risks and decide whether you're a good candidate or not. It also depends on whether why you had a C-section in the first place. Some people will just, if the shape of their pelvis does not allow them to give birth naturally, they will not ever be able to have a VBAC. So it's just important to find a provider that's very supportive of that. Good? Okay.